Hey guys, it's Leah B from Prestige Veteran Medical Consulting. I'm a U.S. Army veteran, a physician assistant, and former CMP examiner. Today, I want to come on and do a discussion about meniscal tears and VA disability and how that can relate to a lot of veterans, how they can get service connected for it from a primary or secondary standpoint, and what does it mean. So we've done a few videos on the knee in the past. I did a huge video. It was like, not huge, but like 45 minutes or an hour. Couple of years ago that I thought was a great video that's very extensive over the knee as a whole, right? But I'm trying to do a few breakdowns and really segment and do some shorter videos so that if you just want to focus on the meniscus, you can kind of hear some info about the meniscus, right? So let's start off with what is a meniscus, right? What is a meniscal tear? How do they happen? Things like that, right? So here is my handy knee model, okay? And so in my handy knee model, we have just a brief overview of some of these structures. We have the patellar tendon. Also, it goes up to the quadriceps. So it's called the quadriceps tendon up here, but it's one continuous piece, and it goes over this patella or the patellar bone, and it becomes the patellar. It's the patellar tendon, right? And so the joint itself, we have that meniscus. I'm sorry, we have that patella. We have our femur bone or the thigh bone, and we have our tibia down here, and we have our fibula, the smaller bone here. Okay, there are some other supporting structures. I'm going to move this out of the way. We have our ligaments, right? So we have, wish I could cut this away, but that would ruin the thing, right? So we have some ligaments on the side, and it helps our knee stay stable, right? So there is a little bit of mobility, but we have our MCL and our LCL on the sides here, our lateral and medial collateral ligaments. And then we have on the inside, we have the ACL, that X pattern there, right? The ACL and the PCL, the anterior cruciate ligament and the posterior cruciate ligament, okay? And that helps so that your skin is on the outside, so your knee is not going to just fall forward, right? Out of your body because you have skin there and fat and all that stuff. But these help keep it stable in the joint, right? So if your ACL is busted, we'll do a video on that later. If your anterior cruciate ligament, this one up front, is busted, it could just kind of go all cattywampus, but it keeps it in place, right? Same thing with your PCL. All right, let's get off of those. So the meniscus are these disc-shaped items here, okay? And they provide more joint stability too. So a person could have tears in a whole bunch of stuff. In fact, Adrian Peterson, I've mentioned this before, had something called the terrible triad before, and he busted several of his meniscus and several of his ligaments at the same time from being hit on the side. Okay. So this meniscus, generally speaking, provides you some support, and it keeps this joint kind of like together. It's part of those supporting structures, but you can get a tear, right? Anywhere along this meniscus, right? On any of these portions. Okay. And they can cause a variety of symptoms. So you can get what's called a bucket handle tear and a bucket. And I don't want to go too far in detail, but some of these things can cause your knee joint to lock or catch, right? So those are some of the things that they talk about is locking and catching. And it can even get to a point with a bucket handle tear where it will lock and the person won't be able to get it unlocked, right? And that becomes something that needs surgery pretty quick if that happens. At any rate, most people with a meniscal tear can have some joint instability and some catching and locking, like I said. So how does that happen? Well, it can happen traumatically, or it can even happen degeneratively, right? So a lot of people don't even really think about that, but it's true, right? So you can, if you have a bad twisting injury, imagine if you twisted your knee by accident, whether you're playing basketball, somebody hits you from the side or whatever, and you have a good sharp twist, it can tear that meniscus, okay? So I'll kind of get off that. And then from a degenerative standpoint, if you've got arthritis in your knee from other stuff, you can just, over time, that thing can just wear down and be more friable, what we call friable or tearable. Okay. Not terrible like bad, but like, rips, right? So how do people get service connected for this? Well, if you had a meniscal tear in service and you had surgery, or you just tore your meniscus, it was identified on an MRI or whatever, and you were diagnosed, that might be pretty straightforward. Maybe it was misdiagnosed and you've got some buddy letters that say you had knee pain for years, right? In service, and you weren't diagnosed with it at all. that may be something that you could look at post-service if you have some good supporting statements, right? Perhaps you developed arthritis, you had some kind of knee injury in service and you developed arthritis over the years and it wore that little meniscus of yours out and caused it to have a degenerative tear later in life. Let's say from a secondary service connection standpoint, you have, an injury to several other joints and it made you more predisposed to having more wear and tear on that joint. And it caused you to have some type of degeneration, or your ankle is busted and you have an unstable ankle and it made you twist your knee. That's possible too. There's a million possibilities, right? It's all case specific. So remember, this is not medical advice. So you need to make sure you're always following up with your medical professional for any kind of advice about your specific case. And this is also not legal advice, right? Because I'm not an accredited claims agent. I'm not a VSO. I can't help you guys with administrative stuff. Just try to put out good information that may be helpful for you to talk to your doctor about, or to talk to your VSO or whoever about. Okay. So, I hope this was helpful. That's my little stint on the knee. I do have one little article to read to you guys that I use sometimes about degenerative meniscus tear. So this is a article published in 2016 in the British Medical Journal entitled Management of Degenerative Meniscal Tears and the Role of Surgery. In the article, they state that meniscal tears are categorized as either traumatic or atraumatic, also called degenerative, right? Traumatic tears tend to occur in younger people following a serious traumatic injury. Degenerative tears are typically seen in middle-aged or older people, and often accompany knee osteoarthritis, like I mentioned, right? So given that there was no, so if there's no history of traumatic event and your little meniscus just wears out over time, I've seen that in rating decision letters where they're like, meniscal tears are traumatic in nature and they must have had a trauma. Well, no, like you can have a degenerative meniscal tear and it can just wear out due to other stuff. So I would definitely, just every case is case by case and every case is different. So I hope this was helpful to you guys. Please drop some comments and let me know if y'all have any questions, and I'll talk to y'all soon. Thanks.